Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Balada from Roots Community Health Center, reporting for the week of July 18, 2022. After a pandemic status update, I am going to talk about the link between oral health and COVID-19. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. You can see here that Alameda County total daily cases are kind of at a plateau. We know that those last several days will continue to be updated as new case data comes in, and we know this lags a bit behind. We also know that this is a drastic undercount given the volume of home testing going on, but still, we're still not seeing it come down as we would like to. Same goes for when we look at the total cases over the previous 14 days. And this does lag behind, but the last reported total is at 9,870 cases. And when I reported a week ago was 9,599. So it's actually come up a bit, even on the 14-day total from reporting last week. So once again, it's just not coming down the way that we would like to see it come down. It's seeming to just kind of fluctuate around a relatively high case rate, even though we know that this is drastically undercounted, and we think that there's about at least 8 positive home tests for every 1 laboratory confirmed test. So we are certainly seeing quite a number of cases, and it's not looking like it's coming down at the time. Now, in thinking about or looking at vaccinations, we're seeing that in the under 5 vaccination, and this was the most recent age group that got their vaccines approved. And so it's been about a month. And here in Alameda County, we're just marching right along. We've got 13% of our little ones, 6-month to 4-year-olds, that have received at least 1 dose. And if we look at the United States, we've got almost 400,000 little ones from 6 months to 4 years old that have received their first dose of vaccine in the United States. So we'll just continue to keep an eye on that, but we see that we're off to a pretty decent start there. Unfortunately, looking at hospitalizations and death, we're again just not doing so great. We're going the opposite direction than we would like to go. When we look at the United States, we see that the 7-day average is at over 5,800 hospitalizations. This is almost a 15% increase from the prior 7-day average. So this is not going in the direction we would like to see it go. And likewise, when we look here in Alameda County, we can see that we are at 159 people in the hospital. 25 of those are in the ICU, so that's very significant. That's also increased for when I reported last week, when it was 148 in the hospital and 20 in the ICU. So it's going up. Actually, even between then and now, it had gone up even higher to 165. Now we're at 159. So again, this kind of zigzagging, fluctuating, but really on an upward trend overall. This is not what we want to be seeing at this juncture in the pandemic. But this is where we are nonetheless. And when we look statewide, when we ask ourselves, so who are the folks who are getting hospitalized? And we can see that we're still seeing that the unvaccinated are 9.4 times more likely to be hospitalized with COVID-19 compared with those who are fully vaccinated and received their boosters. And so you can see this graph here where the red line represents those who are completely unvaccinated. And so by and large, even though it certainly is possible to get hospitalized, even though you're vaccinated, the chances are significantly lower And really those at greatest risk are those who are unvaccinated or those who may not have mounted a good response to the vaccine, like those who are immunocompromised. And when we look at deaths, we have lost 1,933 people in Alameda County to SARS-CoV-2. 562 of those were in the city of Oakland. And unfortunately, we're still losing people. If we look nationwide at the 7-day averages, we're seeing that we're losing over 400 people per day right now. And if we continue at this rate, and likely, unfortunately, will increase when we go through like our winter surge, but even if we just continued at this rate that we're at now, that is over 150,000 people per year that we will be losing to SARS-CoV-2. So we are still very much in a urgent situation as it relates to SARS-CoV-2 and as it relates to just the number of people that are still being hospitalized and dying. When we look at deaths in the state of California, we can again see that those who are unvaccinated are 8.2 times more likely to die from COVID than those who were fully vaxxed and boosted. So you can see again that significantly the highest risk folks are those who are unvaccinated. Of course, it is possible to lose your life to SARS-CoV-2, particularly those who are immune compromised, those who are elderly, those who may not have mounted a good response to the vaccine. But by and large, if you are vaccinated and boosted, you are still being protected from the worst outcomes of hospitalization, ICU, and death. And when we look at the variants, we can see that BA.5 is pretty much taking over. It is set to kind of completely take over soon. You can see the geographic distribution really in all regions now. BA.5, the dark green there, is taking over, and it is around 60 to 70% of cases nationwide at this time. At this point, we don't know if it's causing more severe disease or not, or different types of symptoms. You hear all kinds of different anecdotes, but right now we just don't know yet. We do know that it is considerably more contagious. It's also getting around our prior antibodies that we may have created from having been infected before or having been vaccinated. That second line of defense so far in our immunity seems to be holding up against severe outcomes. So once again, if you've been vaccinated, even though it wasn't specifically against the BA.5, it does look like those vaccines are holding up decently well against hospitalization and death. However, that is if you are fully vaccinated, which includes being boosted. So if you're all the way up to date on those boosters, and particularly for those who are older, we really, really want to make sure that you've got the adequate protection. The other thing that is positive is that our treatments are all holding up well against BA.5. So that is definitely good news. Remember that we've got these treatments for outpatient use, and the Paxlovid and the remdesivir, as well as that fourth line, the molnupiravir. Actually, the way that they work, we really don't expect to find new variants getting around those treatments. So those we expect to hold up well. The monoclonal antibodies are rather specific, and they actually give you antibodies against the virus. And so we keep a close eye on those, but so far the one that we're using, the bebtelovimab, does appear to be holding up well against the BA.4 and 5. And likewise, I'll mention here that the Evusheld, which is also a monoclonal antibody, but it's one that we want to give people who we are worried did not mount a good response to the vaccine, or those who could not take the vaccine for some reason. Those folks should get Evusheld, because that will provide protection for about 6 months, and it is holding up so far against BA.5, so that is also good news. So making sure that we have as much protection as possible so that we can avoid those folks that are being hospitalized or are losing their lives to SARS-CoV-2. We can prevent that with vaccination, booster, Evusheld for those who can't be vaccinated or may not mount a good response, and then treatment if you do catch it. And so today I want to talk about what I think is a very interesting, fascinating finding around SARS-CoV-2 as it relates to your oral health. So there have been actually quite a number of studies that have shown a correlation between people having gum disease and them doing poorly with SARS-CoV-2. And we've seen these studies from all over the world, actually, even from early on in the pandemic. And we're still really learning. Don't understand a ton about this, but I'll kind of go through what we think we know, what we kind of are hypothesizing, and what to do about it. So gum disease, also called periodontitis, and it is a gum infection that can ultimately damage the soft tissue, and if it's gone untreated, it can destroy the bone that actually holds your teeth in place. And so for that reason, if you've got gum disease, it can cause loose teeth or even losing teeth. And this is a very common condition. It's also a preventable condition with routine dental care. And we know that with the pandemic, a lot of people have held off on going to the dentist. And so if they had gum disease, it may be getting worse at this time. And so, as I mentioned, there have been many studies. They've been printed in dental journals and translational science journals, infectious disease journals, kind of showing this link between gum disease and poor COVID outcomes. Sometimes hard to sort these things out because sometimes people who are just sicker or overall in poorer health may have gum disease. So is it the gum disease that causes worse outcomes with COVID or those other underlying conditions? We'll need some really rigorous studies. But we've got some that are pointed to some pretty, I think, significant findings. And so I'll point out a couple of studies. I put them in the post that were basically looking at gum disease in inpatients and how did those folks do who had periodontitis compared to those who did not. And really what they found is quite a significant correlation. And so what they found was that your odds of needing to go onto a ventilator were 7.5 times higher. Your odds of being admitted to the hospital, 37 times higher. Odds of dying, almost 15 times higher. So this is quite significant, quite dramatic. And it wasn't able to do a cause and effect again. But there's something going on there. And I think that this has, again, it's been replicated in all kinds of studies, large and small, all over the place, just showing this correlation, right? So that's not causation, but it is a correlation. And so it's something that's sort of worth taking a closer look at. And so I think one of the studies that's in the post did use a kind of validated assessment. So it wasn't just people saying, I have gum disease, because that was one of the limitations in a lot of the studies that I've seen from other parts of the world, is that it just went by the person saying if they had gum disease or not. But this one actually used a diagnostic methodology that has been validated, so it's sort of accepted. And it assessed the association between gum health and COVID-related outcomes. And it showed these sort of dramatically poorer outcomes with COVID for people who had gum disease. And so what that study was suggesting was that we should be assessing the gum status of those who have COVID to see if that might help us to identify who might be at poorer risk during the pandemic. So I think that's one conclusion, but I think that there are others. I think the main take home is the need to maintain good oral hygiene and also get your dental care if that's something that you've been holding off. There was also Another study, and I included this one in the post, and I like this one because it did do some case matching and so it looked at people who had gum disease and those who did not. And it also found significantly higher rate of complications, including death, including ICU admission, and including the need for going onto a ventilator. The other thing that this study did was it looked at some of the blood tests that we look at to see about inflammation, and it showed a significantly higher levels of these blood tests called D-dimer, and also the white blood cells, and also C-reactive protein. These are tests that we might do to see if someone is going into kind of like an inflammatory state. And they were actually higher in those so everyone had COVID, but it was higher in the group that had the periodontitis compared to those who did not. So there is some suggestion that it is this inflammation that's going on. And so periodontitis does cause this level of inflammation, of course, to a lesser extent than severe COVID, but perhaps it's the fact that the two are coexisting that is causing these more severe outcomes. So their conclusion was periodontitis was associated with a higher risk of ICU admission, the need for assisted ventilation, and death of COVID-19 patients, and also that they had these increased blood levels of the biomarkers that are linked to severe, worse disease outcomes. So those with COVID who have higher levels of those D-dimer and C-reactive protein, they tend to do worse, and those were higher in people with the gum disease than who didn't have gum disease. So again, correlation does not equal causation. There's more to learn here, but some of the theories are very, I think, well-founded and interesting. So one is that if your oral cavity has sort of an immune barrier there, and if it's broken down by gum disease, then basically the SARS-CoV-2 may more easily be able to disseminate into the circulation, so into the bloodstream through oral reservoirs in saliva, or it may otherwise be able to more easily travel into the respiratory tract. So there's a concern that the mouth harbors high levels, like a reservoir of SARS-CoV-2 that can then get into the respiratory tract. And this has actually been seen in other respiratory illnesses. So this is not actually a brand new phenomenon with SARS-CoV-2, but having this kind of a dramatic increase in poor outcomes of people with gum disease is certainly looks to be a unique and significant finding. And it's so much so that actually in the UK, there are some hospitals that have protocols that include specific oral hygiene measures. And it is based on the research that, again, the mouth is a reservoir. When it's a reservoir, also means that the virus can actually replicate itself there. So if within the mouth you have an environment in which the virus lives and can continue or exist and can continue to replicate, and then it can pass from the saliva into the blood vessels and into the lungs. So that means it can go just through the bloodstream, not necessarily through just sort of inhaling the viral particles. And so I linked in the post actually a protocol from one of these hospitals in the UK. They state that the steps that they put together are based on advice from the Public Health Department of England, which is called the UK Health Security Agency, and also the European Federation of Periodontology. And they've put together these steps that have to do with very careful brushing of the teeth with a fluoride toothpaste at least twice a day, especially at night is important so that there's less virus in the mouth while you sleep and are sort of breathing deeply and so on. And that you also, floss in there in between the teeth. And they have some special mouthwash varieties that they recommend. You'll want to check with your dentist to see if this is something you should be doing. These are mouthwashes that are specifically meant to reduce plaque. And it also gives some specific instructions if you have dentures and how to kind of clean them to make sure that you remove all of the debris. And then they basically say that that they're investing in this. They're basically making this part of the protocol. They're making it voluntary. It's not required. But really they seem to be stressing the importance of maintaining good oral health, and that they believe that it may improve your outcomes should you end up with SARS-CoV-2. So we don't have kind of enough, evidence to give us all the guidelines that we want, but you can never go wrong with good oral hygiene. And we know that there are a lot of oral health disparities in this country. Access to dental health care can be very difficult, sometimes even more so than medical care. And somehow in this country, we've managed to sort of separate the mouth from the rest of the body and the brain. And so we have all these silos in our system that sometimes make it so that we don't have enough rigorous study around the connections between these things. But we all know that oral health is definitely connected to our overall health. It is connected to heart health. There was even a study in a British dental journal that showed that particularly those with heart disease were even more susceptible to bad outcomes from SARS-CoV-2 if they have gum disease. And we know that people with valve issues and things like that, we always want to be careful when they have dental procedures done. So we're not oblivious to these connections. We know that they exist. And so, but these studies are definitely kind of putting a finer point on things and really underscoring the need for excellent oral hygiene, getting to the dentist if you haven't gone. I know a lot of folks are nervous to go to the dentist. Feel free to ask them about their hygiene protocols. Make sure that they are wearing N95 masks in the dental office, that they have good ventilation. You may want to be the first patient in the morning so you don't have to wait in any small spaces with a lot of people. We know that you'll want to wear your high quality, high filtration mask, but obviously you have to take it off while you're getting care. So don't be shy about asking all the questions you need to ask to feel comfortable that your dental office is taking all the recommended precautions around SARS-CoV-2. But good oral hygiene and good gum health are important for your overall health, and they may even be important to helping you in the event that you do catch COVID, that it does not progress into the respiratory tract if we can reduce those reservoirs in the mouth. So I think it is definitely worth giving some thought and taking a look. And we know that we want to make sure that we are vaccinated and boosted in order to prevent the most severe and tragic outcomes of SARS-CoV-2. We also want you to make a treatment plan. This is something that you should do now with your primary care provider. If you don't have one, please get one. You should know what it is you're going to do if you catch SARS-CoV-2, because many of the people who we are still losing to SARS-CoV-2 are not getting the treatment. And we could be saving lives of those people if they act fast and get the treatment. So if you are not vaccinated, you should get the treatment. If you have any underlying conditions, the link is in the post, you should get the treatment. If you are older, if you are immune compromised, you should get the treatment. If you're immune compromised, you should also ask your doctor about Evusheld. You want to do that now because it's going to give you 6 months of protection. All of these things we want to do before we catch SARS-CoV-2. Before we need it, we want a plan. And we are going to make sure that we are wearing a high filtration mask. And for those of you who are still in surgical, and I see a lot of you out there, those are not going to cut it in an indoor environment. And so, or especially in an indoor environment. And we're even seeing people catching COVID in outdoor environments. So you're going to want to still maintain all of those precautions, the distancing. So even if you're outdoors or someone's close to you, and they're positive, you can still catch it. So all those layers of protection, testing before you get together is one layer. It's not foolproof. If folks are vaccinated, that's one layer. It's certainly not foolproof. Good ventilation, opening those windows, eating outdoors, drinking outdoors. And when you do need to mix with those outside your bubble and you need to be indoors with them for any period of time, that is when you really need a filtration mask. So either a KN95 or an N95, and it needs to fit you well. When you breathe, you should see it kind of suction in a little bit. And when you breathe out, it should kind of suction out a little bit. And so those are kind of a quick way to see if you've got a good fit. So it's important to get a good seal, and also limit your time indoors. Don't linger too long. And in general, we want to maintain a balanced, nutritious diet, get some good exercise, manage your stress levels, consider a multivitamin supplement with additional vitamin D, and get a good night's sleep. Thank you so much for joining us. We'll look forward to seeing you again next Tuesday at 10 a.m. See you then.